For my clinical practice discussion this semester, I've chosen to do food insecurity. And so some of the goals for this presentation today are going to be take the definition of the food insecurity that we have discussed through the discussion questions I sent out. And we're going to talk about that in terms of local and provincial and as well as national food insecurity. We're going to look at our perspectives and how they might be different for other people in society who aren't healthcare focused. Then we're going to talk about how, as community health nurses, we are very well situated to take action against food insecurity, and we're well prepared. We have a good toolkit. And then finally, we're going to talk about COVID and how food insecurity is related to this pandemic that we are currently experiencing. We know that food is a basic need. It's at the bottom of Maslow's hierarchy of needs, and having food security means we are meeting this need. At the World Food Summit in 2006, they defined food security as when all people at all times have physical and economic access to sufficient, safe, and nutritious foods that meet their dietary needs and food preferences for an active and healthy life. And on the contrast, food insecurity, also defined at the World Food Summit, is when there is a limited or uncertain ability to acquire sufficient, safe, and nutritious food preferences in a socially acceptable way to meet dietary needs and food preferences for an active and healthy lifestyle in a way that maintains a sustainable food system that maximizes community self-reliance and social justice. So there's that sustainable word again that we've been talking about this whole semester. We want to make sure that individuals and communities are able to do it for themselves and that it's not us coming in and leaving something that they can't continue to sustain. A sustainable behavior leads to a healthier way of life. Measuring food security or insecurity in households is the food security status, and this can range from anything like concerns about running out of food before you have more money to buy more, or even the inability to afford a balanced diet. Could be going hungry in general, or it could be missing meals, and extreme cases could be going days without food and not knowing when your next meal will even be. And all of these are related to negative health effects, including higher incidences of food-related chronic illnesses like diabetes and obesity, could be higher rates of hunger and malnutrition, or increased incidence of foodborne illnesses. So as nurses and also as members of society, we can easily identify that eating healthy is not as simple as just going out and eating healthy for a lot of people. The UN has identified in their Sustainable Development Goals, one of their goals is zero hunger by 2030. So not only is this a local issue, this is a global issue, and it's something that could be tackled by healthcare professionals and society in general, everywhere. So some reasons why someone or a family might not necessarily be able to eat healthy. So it could be economic factors. This was a really common one identified in the discussion answers. So this is poverty, insufficient income, financial burdens, a variety of different things related to economics. It could be environment or accessibility. So if a family is living up north, or if they are just even living somewhere in a neighborhood in Saskatoon without access to a grocery store close by in walking distance. It could be a variety of different things. It could be related to coping skills or social factors. It could also be related to working conditions or maybe even other factors that are unique to the individual or the family. So there's a lot going on that could result in an individual or a family or a community being food insecure. So I want to talk now about the idea of a food desert. And this is defined as an area where people are food insecure due to two reasons. So the first reason is because of where they live, so geographical, and the second reason is because they lack money. We know that income is the number one social determinant of health, and so if an individual is lacking in income, we can see how that could directly correlate to food insecurity. So in a report, Food Access in Saskatoon in Community Report in 2010, they found that only 45% of Saskatoon's population is within walking distance of a grocery store, and they defined walking distance as within 1 kilometer. However, 75%, so much larger percentage of the population, is within walking distance of a fast food outlet. So specifically related to food deserts and grocery stores and this sort of thing, a story that's been circulating in the news over the past couple months, past year or so, is how the 3 Safeway stores in Saskatoon were closing to revamp, to rebrand, and they would be opening again after 3 or 4 months. So this is leaving a period for residents in that area where they have no access to healthy food because these Safeway stores were the only grocery stores within walking distance or within reasonable transit distance for these residents to access. In contrast, with a business or economic perspective, Safeway and its parent company are closing around 25% of their lowest performing stores across the country to rebrand, to make it into a different grocery store so that they can increase profits and have a new, fresh look for their stores. So that is a positive for them, whereas it will have negative health consequences for members of the society. Eventually, long term, they will get their grocery store back open and they will be able to reaccess those healthy food options. But in the meantime, 3 to 4 months is a significant period where they don't have access to those healthy food options. And so this is at a local level that we've been discussing. And now to talk about a provincial level, a report called The Cost of Healthy Eating in Saskatchewan Impacts on Food Security was released in 2009. So I realize it is a bit dated, but does still have very relevant information. So what this group of public health nutritionists, as well as the Saskatchewan Health Regions, did was they put together this idea of a national nutritious food basket. And this basket is essentially Canada Food Guide recommended healthy eating options for the family size of 4 people for 1 week. So in urban areas, the cost of this National Nutritious Food Basket for 1 week is $205.02 to feed a family of 4. And if we look at this compared to northern Saskatchewan and rural areas, this cost goes up to $252.27 per week. Quite expensive to feed a family of 4 with healthy, nutritious meal options for a week. And that adds up very quickly, especially with other necessary expenses like rent and other things. So this report actually also found that food costs are highest between age 14 and 18 for males and between age 19 and 30 for females. So on top of whatever your weekly spending is for food, if you have individuals in your family that fall into those age ranges, then you're looking at a higher cost of weekly food spending just to accommodate for healthy food options for people in those age ranges as well. Nationally, at food insecurity issues, there's an organization called Proof, and they are dealing with food security across the nation. So they released a report just a couple weeks ago, actually, and it showed that 1 in 8 Canadian households are food insecure to some degree. So not all the same degree, but they're on a spectrum of food insecurity. And the most interesting part about this statistic is that this does not include First Nations reserves, it does not include homeless people, and it also does not include people in remote rural areas. And these 3 groups of people are already at a very high risk for food insecurity. So the 1 in 8 household statistic is alarming without including 3 of the most vulnerable populations as well. I want to talk about how we as community health nurses are well positioned to tackle this issue of food insecurity, both locally, provincially, nationally, and even globally. So first of all, we are advocates as nurses. It's part of every type of nursing, no matter where you're going, and it's especially part of community health nursing. And then also we have a strong working knowledge of the social determinants of health and an understanding of the benefits of upstream care rather than downstream or reactionary care. So all of these things, along with our individual toolkits that we've developed through nursing, are positioning us very well to help out with this issue. So one thing that I wanted to relate to food insecurity as well is the idea of the social ecological theory. So this is a focus on individual, community, and systemic factors and how changing those factors can result in changing health in society. And so when we look at the community health nurse's role in tackling food insecurity and we relate it to the social ecological theory, we can identify interventions at each of the 3 levels. So first of all, there's individual and family interventions. That's the first level. Some of these things could include like education for individuals and families. This could be cooking classes or just healthy food option education. It could also be connecting clients to resources like social workers or nutritionists, because we are building that one-on-one rapport with them, and we are establishing the trust, and then from there, if they're seeking it or we feel it's appropriate, we can make those referrals for them. The next level up is the population or community-based interventions, and this involves awareness campaigns, involves sharing of resources, referring to programming again. An example could be community gardens, something that multiple people in the community can access. And an example at our North Park Wilson School and in Saskatoon Public Schools in general is the CHEP program, the CHEP. It was one of the central locations for it was run out of the canteen at North Park Wilson, and it's providing for school lunches for kids all over Saskatoon. So that's an excellent example of community-based interventions that public health nurses could get involved with. And then the third level is systemic interventions or policy related. And this could involve nurses partnering with larger organizations to affect policy change. And it also can involve nursing research related to food insecurity, because this research can then influence the development of policy. So that's very important there. And I think the take-home point for the community health nurse's role in food insecurity is that we have to have both the confidence to take the action and make a difference, as well as be aware of our own biases and biases that could be present in the community, and just be open-minded in our work with different individuals and communities. The last thing I wanted to talk about is COVID-19 and how that is affecting food insecurity in Canada. So the first thing is hoarding. People going to the stores getting excess amounts of goods that they don't need, and then people who do need those goods are not able to access them. So whether this be toilet paper that people do not need that much of, or else it's people who are only able to go to the grocery store maybe once a week because they don't have a ride regularly, or different scenarios like that, all of that can lead to further food insecurity for Canadians that's unnecessary, quite frankly. And secondly, people are afraid to go to the stores due to a risk of the spread of infection, which is somewhat valid, and so therefore, if they're staying home, they might not have the same access to healthy food options as they would if they were able to go freely to the grocery store without fear. Unprecedented times where businesses are being shut down, people are being laid off, Canadians are out of work all over the country. This is an increased time for food insecurity for sure, especially in households that may not have been insecure previously. And so the $82 million that the federal government, that the Liberals have promised for Canadians at this point in time is almost like a breath of fresh air. It's relief for us. Not everybody's a Liberal or conservative. Everybody has their own political views. But at this point in time, when we are fighting a global pandemic and we need to come together, it is a relief. Some people might not think it's enough. Some people might think it's too much for certain people. But we can all agree that there is something that needed to be done. And the government took quick and probably effective action towards combating these problems that are going to come up for sure. And so I think that that's something that is to be commended at this point in time. Related to COVID, there is a lot going around for how you can help, and one of the main ways to do this is through food bank and different food security organizations. There's a website called foodsecurecanada.org, and they have a big list of all across the country of different food organizations that are taking donations in whatever form they need, and so it's all specified on that website. As well, there are different other aid organizations that are helping out. So there are many ways that we can help out. As community health nurses, I think it's important that we take the lead, and we encourage those around us to do that as well, both through modeling it with our own actions and sharing it around, spreading the resources, spreading the word, so that people know what they can do to help out. So to summarize, we've defined what food security and food insecurity are, and looked at some local and provincial examples of this. We've established what the prevalence of food insecurity is nationally, and then we've also discussed how community health nurses can play a role in combating food insecurity through the social ecological model and the 3 different levels of intervention. And then finally, we've discussed how food insecurity might be related to this pandemic that we're experiencing right now, and then ways that we can get out of this together and help each other out in this really hard time. So thanks for watching, guys.